When we think of bipolar disorder, our minds usually jump straight to mood, the intense highs, the crushing lows. But what if I told you that's only half the story? There's this whole other battle going on, one that's often invisible, and it has everything to do with a person's physical health. Today, we're going to pull back the curtain on that unseen battle. So, what does this unseen battle look like in real terms? We'll look at this number, 10 to 15 years. That's the average reduction in life expectancy for someone living with bipolar disorder. I mean, that is just staggering. We're talking about a decade, maybe even two, lost. It's such a powerful and sobering reminder that this goes way beyond mood. It affects the entire body. Okay, so that leads to the really big question. Why? How does a condition that we typically think of as psychiatric have such a dramatic impact on a person's lifespan? Well, the answer isn't just one single thing. It's more like a complex puzzle, and we're about to start putting the pieces together. All right, so to understand the why, we need to look at what's really driving this. It all comes down to three main factors. Think of it as a tangled web with three main threads. First, you've got the direct biological effects of the disorder on the body. Second, they're the associated lifestyle factors. I mean, just think about it. It's incredibly difficult to maintain a healthy diet or exercise routine when you're in the midst of a severe mood episode. And third, and this is a really tough one, you have the side effects from the very medications that are absolutely essential for treatment. And this quote right here, it just hits the nail on the head. Doctors and patients are, quite rightly, laser-focused on stabilizing mood. That's priority number one, for sure. But because of that intense focus, physical health problems can get pushed to the side. They can get missed. It creates this dangerous blind spot where things can get pretty serious before anyone really notices. And just to put the severity into context, look at this. People with bipolar disorder face double the mortality risk of the general population. But here's what's really critical. That risk is even higher than for people with unipolar depression. That tells us that there's a unique physical burden that comes specifically with this diagnosis.
So we've talked about the drivers. Now let's get into the what, the actual ripple effect this has across the entire body. We're going to look at the specific physical illnesses, or what doctors call comorbidities, that are so common for folks with bipolar disorder.
Wow, okay. This chart gives you a really powerful snapshot. On average, a person with bipolar disorder is managing 3 to 4 other health conditions. And look at these rates. Metabolic syndrome, hypertension, cardiovascular disease. The numbers are incredibly high. The big takeaway here is that living with bipolar often means you're juggling multiple chronic health issues all at once. It's a lot.
Let's just zoom in on one example, type 2 diabetes. The risk for someone with bipolar disorder is up to 3 times higher than for everybody else. 3 times! And here's the kicker. This increased risk exists even in patients who haven't started treatment yet. So we can't just blame it on medication. The disorder itself is a huge factor. And it's not just metabolic issues. We also have to talk about chronic pain. People with bipolar disorder are more than twice as likely to live with things like migraines or other persistent pain conditions. You can just imagine how deeply that impacts quality of life, and it adds yet another complex layer to their overall health picture. Which brings us back to that difficult reality of treatment. The medications you see here, lithium, anticonvulsants, antipsychotics, they're the cornerstones of care. They're absolute lifesavers. But, and it's a big but, they can also contribute directly to the very physical problems we've been discussing, from weight gain and thyroid problems all the way to metabolic syndrome. It's an incredibly delicate balancing act.
Okay, so laying out the problem is one thing, and it's a serious one. But the good news is we're not just going to leave it there. Now let's talk about the solution, because there is a clear evidence-based path to better health, and it all starts with a shift in how we approach care. And that path forward is something called collaborative care. It sounds a little bit formal, but the idea is actually really simple. We have to stop treating the mind and the body as two separate things. It means getting the psychiatrist, the family doctor, and other specialists all on the same team, managing a person's health holistically, just like we would for any other chronic condition.
So, what does this actually look like in practice? It looks like a proactive health checklist, just like this one. It's not rocket science, right?
It's about regularly checking the basics: BMI, blood pressure. It means doing baseline lab tests for blood sugar and lipids. And for folks on specific meds like lithium, it means keeping a really close eye on thyroid and kidney function. The whole point is to be proactive and catch problems early. And this is not a one-and-done kind of thing. As you can see, it's an ongoing process. You start with a baseline exam. You follow up with regular checks at 3 months, 6 months, and then annually. It creates this continuous loop of monitoring and really a partnership between the patient and their care team. It's about staying on top of it together. Now, this final quote highlights a huge systemic barrier. It's a phenomenon called diagnostic overshadowing. It's where a person's physical symptoms get dismissed as being just a part of their mental illness. This is exactly why it's so vital for patients and their families to be armed with this knowledge so they can advocate for themselves and demand the comprehensive, whole-body care they absolutely deserve. So when you put it all together, the conclusion is pretty clear. We have to see bipolar disorder not as a disorder of the mind, but as a condition that affects the entire body. The evidence shows that integrating mental and physical care isn't just a good idea, it's a life-saving necessity. Which really leaves us with one last important question to think about. Isn't it time we treated all mental health as whole body health?